We are so thrilled to have a great asset to our community here with Dr. Gallagher, affectionately known as Dr. G. She started her own practice recently in 2020. Prior to that, she's had over 20 years of experience with pediatrics after going to school at UNC. She also has 5 kids of her own. And so it's fair to say that she's an expert in these topics. And Dr. Gallagher is here to talk with us about something that's really important. And I think I'm personally really excited to be here for it, because no matter how old your kids are, environmental influences can impact our families at any age, right? So she's going to help talk about how the environment is crucial for like the physical as well as the mental health for our children's well-being, be it through understanding about air pollution, water pollution, and other environmental insults. And she'll also share about how we can get involved. And everybody knows there's no such thing as fighting a mom who's like committed to helping her children. So we can be a force, that is for sure. And without further ado, thank you so much, Dr. Gallagher, for joining us. We're so thrilled to have you and to hear what you have to share with us.
Thank you for having me. I'm happy to be here. So I'm happy to be here for a lot of reasons, but I wouldn't be a pediatrician if moms and babies and families were some of my favorite people. But I'm really happy to be talking about this topic. I think that we all physically saw with our eyes this year the impact that environmental injury has on our communities and on our children. And so I think it's an appropriate year to be discussing this. So it's a big topic. I have a few things to go over. The first is to talk about what is environmental health. And then secondly, to narrow it down and talk about why pediatricians and moms need to be educated and also need to be involved in this topic. And then we're going to drill down and talk about one particular aspect of environmental health, and I'll go over some of the data. And then last, we'll talk about how to get involved. So first, let's talk about what is environment. So for our children, environment means 4 things: people, physical spaces that they live in, the human communities that they belong to and move through, and then the planet itself. So people is not just your family, it's your caregivers, your family, of course, your community, the folks at your school, the people who give you medical care, the list goes on. And then physical spaces include not only your home, which is where children spend most of their time, but also the infrastructure of the community itself. Whether it is the type of jobs that are offered to parents in that community, the traffic patterns that exist, the quality of the water, the food available. And then there are the human communities, namely, what is the neighborhood that a child lives in? What sort of outdoor safety is there once they leave their home? Is there access to open spaces for play? And what is the physical structure of the community? Is it urban? Is it rural? Is it a nation that is functional or not functional? All of those have huge impacts on children's health. And then lastly, the planet itself, our ocean and freshwater quality, our air quality, the natural spaces that are around us, and the individual ecosystems that our children live in affect their health. So why is this concept of health of environments, health of everything from your home, being a healthy home, to communities and schools, to open spaces and ecosystems and the planet itself, a special issue for children? So the main reason for me when I think about this is that I have a pediatric mindset. So the next generation comes first. And as moms, we have a similar mindset. Our children come first. And so when we look at issues of environmental health, our first question is, how are the children doing and how is it affecting them? And what we do know is that children bear the brunt of unhealthy environments. And they bear that in a couple ways. They bear it with their physical health, their emotional health, their spiritual health. And just to give you an example of how things might be much harder for children and impact their actual health, when we look at those 4 concepts of environmental health, if you think about the people around the children, for example, in pediatrics, we deal with abusive homes, we deal with lack of quality housing, lack of daycare, a huge issue in this area right now, lack of quality schools, lack of access to medical care. All those profoundly affect the health of our children. Physical spaces that are not healthy, unsafe homes, parent work burdens, unemployment, water quality within the home, and food insecurity will negatively affect our children. Our human communities can have positive or negative impacts, but they can be negative when we have a lack of access to either structured or unstructured play and exercise outdoors, if they have no access to nature or they live in unsafe neighborhoods. And then at a planetary level, very fundamentally, children bear the biggest cost when we have poor air quality, when we have air pollution, and when we have extremes of weather, especially extreme heat. So a lot of times when you hear about all those negatives and how they all can be impacting our children, it can feel a little overwhelming. So what I thought I would do is remind you that I come from the perspective of being a pediatrician and a physician, and I'm implicated in this. We all are implicated in this. And so hopefully coming at this discussion from the point of view of not being someone who lectures you from as someone who's doing it all right, I'm really coming at it from recognizing that my work and my industry and medical care has played a major role in harming children's environments. And yet we have actually, as an industry, really transformed, in the past 20 years, especially. And I think the way that physicians and especially pediatricians have helped to reform our medical industry can be a model for us moms as to how we can transform any other community that we play a role in. So just to give you some numbers, the medical industry in the US accounts for 8 to 10% of our nation's carbon emissions. You may say, how is that possible? Well, if you think about all the medical buildings, we sit inside our air-conditioned and climate-controlled buildings with immense amounts of medical waste that's generated. A lot of it goes to incinerators. There's use of a lot of chemicals and products and drugs that, if they are not disposed of carefully, do have negative impact. And every one of those groups, whether it's actually the anesthetics, the drugs we use, the incineration, and also the amount of waste that gets produced, all contribute to our carbon emissions. So by transforming industries and advocating for change, physicians have had and can have from here a huge impact on the health of our climate. And again, I just want to promote this idea of taking encouragement from this idea that we are all culprits, but we all can improve our care of the environment. And to do that, I want to bring in a video that actually was made by a group of pediatricians funded here at Sundance, and that hopefully will be helpful to you. Hold on.
Like most doctors, I began my career by swearing my allegiance to the Hippocratic Oath.
Dr. Gallagher, you need to share your screen.
I was so proud to be part of the tradition of
I'm
the
sorry.
ancient doctors.
I thought I was sharing already. Am I sharing? I'm sorry, did you say I need to share my screen?
Yes, it's not shared yet.
Huh. Oh, you haven't seen my slides? Well then, ladies, I thought you had me sharing my screen. Here we go. But they were such pretty slides. We'll finish up with them. First, let's do a video. Okay, so again, this is Sundance funded pediatric video.
Like most doctors, I began my career by swearing my allegiance to the Hippocratic Oath. As a pediatrician, I was so proud to be part of the tradition of the ancient doctors who swore, in the same spirit as we do today, to treat the sick and protect them from injustice. and above all, to first do no harm. Since the times of Hippocrates, medicine has evolved in unimaginable ways. Inside our clinics, we become brilliant at treating our patients' symptoms. But outside our walls, some of these illnesses are growing to epidemic proportions. Of course, we ask ourselves, what is making people sick in the first place? And why do they keep coming back? In our journey to diagnose and treat the body, we've been to the moon and back many times over, masters and explorers of the very small. But 20 years ago, some of us saw that to understand the problem, we had to take a wider view. From that vantage point, we saw thermometers, each containing enough mercury to poison an entire lake, piled up in our trash. From an even wider lens, we saw medical waste incinerators on our own properties throwing toxic fumes skyward. Dioxins and mercury from waste incineration fell to earth, entering the water we drink and the fish and animals we eat, poisoning our bodies and the developing brains of our children. Our own fingerprints were all over the scene. We were contributing to making our own patients sick, all in direct violation of the oath we had sworn to do no harm. So we formed a coalition of doctors, nurses, and advocates to push back, and pushed healthcare to stand with our oath and clean up our own house. Today, only a handful of incinerators exist in the US, and mercury thermometers are going the way of the horse and buggy all around the world. But while you listen to me, the climate is changing, and the people we serve face perhaps the biggest harm of all. Now we need healthcare to be a leader within this widest scope. Look at healthcare's global footprint. We consume huge amounts of energy on every continent, contributing to climate change and air pollution that kills 7 million people a year. In the US alone, healthcare is responsible for 8% of greenhouse gas emissions. But here's our leverage. We are 18% of the US economy and 10% of the entire global economy. The changes we make really can move entire industries away from harm and set new norms that will positively impact our patients' health. Imagine, for instance, if healthcare fought antibiotic resistance by purchasing only antibiotic-free meat, or how innovative solutions to eliminating waste, like biodigestion, could help power hospitals and reduce air pollution around the world. Healthcare could help make renewable energy viable. By choosing to turn away from fossil fuel, we would reduce the carbon emissions that harm our patients and our planet. We stand at a turning point in the course of medical history, and we can move to a tipping point. It's within our power and our mission. Dr. Martin Luther King said the moral arc of the universe bends toward justice. Join us as healthcare bends toward a more just and sustainable future, rooted in our original oath, do no harm.
All right. So let me get back and get my slides set up. Sorry, ladies, I'm going to shrink you here. I'm still sharing. Sorry, I thought we were set up for the share. And there we go. Okay, see my pretty slides? So just going back, we talked about what is environment. We talked about why we as moms and as pediatricians have
we still can't see your slides, Dr. Gallagher.
I have share on, so strange. I even have stop share, huh?
Can you minimize right now we're just seeing your browser. Can you minimize that?
Okay. I'll get rid of. You get to see all my stuff. Can you see that now? Can you see the slide now?
It's currently frozen.
No, it's like paused on your screen.
Okay.
Yeah.
I think it's like a different desktop that it is using. So let me. Screen sharing has failed to start, is what Zoom is telling me. Please try again later. Okay. Well, guess what? You get just me with no slides then. So this is too bad because I want to show you some stuff. Can we just pause for a moment and try one more attempt at sharing? Can you send me another invite here to be the host? Oh, okay. All right. Can you
Sarah,
see?
yeah, Sarah was gonna.
Yes. Here, let me help you out. 1 second.
Thank you.
Of course. I'm going to withdraw and start again. All right. Fingers crossed that that helps.
How's that?
Yes.
Okay, we have slides. Awesome. Okay. So getting back to this concept that we as moms and as sometimes working moms, but also people who participate in industries and in different communities play a role, but we can also change how we play a role in our children's health. So what have we seen in medicine? We've seen a couple things. So it's actually pretty fascinating how much has changed in the last 20 years. And I thought I'd give an example. When I was in medical school, patients were allowed to smoke in the rooms. So it was only an issue if they were on oxygen and smoking cigarettes. Sometimes that got interesting, but that sounds unbelievably different. So I look forward to what things will seem horrifyingly old-fashioned 20 years from now. But having said that, the medical industry, and especially led by a lot of people don't realize the military branch of our fragmented medical system has done a lot on using appropriate cleaners, decreasing use of plastics, minimizing incinerator use, changing how we have our food production and consumption in hospitals. And then also you forget about this stuff like rodent, insect, and other pest management in hospitals, as well as adding landscaping and green space to promote health. Why did this happen? It did not happen because people thought it would be a nice thing to do. They did it because they appealed to administrations of industries and individual hospitals that it was best for the healthcare of our most fragile patients, which are usually our elderly and our children. And that gets things done. Every single one of those major changes we've had in the medical industry has happened by appealing to people's instinct to care for those two groups. All right, so if physicians can change how we practice and how we work, so can you. So how do we do that as moms or as working moms or as people in our communities? First of all, we make very small changes and make many of them. Secondly, we can also advocate for more healthy communities, and we always keep kids first. Practically, what does that mean? So I thought I'd show some examples of my office. So I don't like to be a participant in medical incineration, so I don't. I actually have a machine that I bought from a guy who runs a small business in Boston, and some of the hospitals there use this. And what we do is we melt down all of our old syringes and needles and our bio waste. And so that little weird plastic contraption you see there with all the different colors is about a month's worth of syringes and needles and scalpels and such. And that way I don't send it to Stericycle down in Salt Lake to be incinerated. It's still a big hard plastic lump, and I put it in the trash and it's going to be there for a long time, but I didn't burn it and dump it onto the lungs of all the people in Salt Lake. We also use compostable things whenever we can, like compostable trash liners, and we use really natural sprays, and we try not and use a whole lot of paper and plastic coverings. We'd rather just clean a lot. So those little changes in a medical office can make a huge difference in how much waste you have. So again, this idea of do no harm that was brought up in the film, I think, is really appropriate for any of us who care about our children's health. And the idea is that we need to enlarge our focus. So how can pediatricians help you with thinking about the environment of your children and how you can become active? First of all, we were one of the first medical groups to get active in this. So we were the first major medical group to make it a statement about the negative impact of environment and climate change on human health. And that was in 2007. And the 4 parameters that were defined then to help make it understandable and also only refer to aspects of climate and environment that had been proven definitively in the medical literature were, first of all, air pollution, secondly, water pollution, extremes of weather, and unnecessary exposure to chemicals that are harmful to health. So what can you as a mother do if you want to think about getting involved in those 4 aspects of environment? So first of all, you can be knowledgeable about the health impact of environment and climate on children. We can all change our home environment, make all those little small changes, and then expand your focus, think about changing your community, and start with advocating for change. So where would you begin? When I wanted to think about this huge scope of everything from lead poisoning to home household cleaners to air pollution to water quality, where to start, I figured I would ask a new mom. So the person who runs my social media has a 5-day-old. And a couple weeks ago, I asked her, if you had to sit and take valuable time and learn about one aspect of environmental health for children, what would you want to know? And she said 2 things. She said, first of all, air quality, just because we all suffered so much from all the Western wildfires this year, and we're starting to see a progressive increase in that impact of baseline air quality here in the West. And then secondly, what she could do having no time. And so we're going to talk about those 2 things. So first of all, let's review the data so that you can feel a little informed. And just to warn you, my data on air pollution, I have hundreds of references on ozone and then particulates less than 2 microns and 2 to 10 microns. And there's a lot out there. But I want to give you some data and some tools so that you can become advocates as well. So let's talk about how children's health is affected by air pollution. So I'm going to give you 3 studies. 1 is a review, 1 is an actual study, and then the third you'll see. But the first one is an older one, but this was what's called a risk analysis that compares risks in different groups and estimates and weeds out what is the contribution of the 2 major culprits in air pollution, which are what we call ambient PM 2.5 and ozone. So ozone and particulate matters, which is what PM stands for, are 2 different groups of what happens with air pollution. 2.5 refers to the number of microns and the size of the particulate matter. So for example, when we had our wildfires this year, we had both big particulate matter, a lot of the 2 to 10 micron particulate matter, but the especially dangerous stuff is the 2.5. And what this looked at was, and again, it's older data, what can we see if we can weed out these 2 things? So first of all, what we can show is that in 1 year alone, we can attribute to particulate matter in American air 83,000 cases of bronchitis, 200,000 hospital admissions and ER visits for respiratory related illness, respiratory and cardiovascular, 2.5 million asthma exacerbations, 4.4 million cases of upper and lower respiratory symptoms, 18 million lost days of work, and between 130 and 320,000 premature deaths. So even if you say you want to get into the down and dirty of this risk analysis, which we could, but we're not going to, it is hard to dial down on these numbers and still not be incredibly impressed by how this one aspect of typical air pollution, which is especially common here in, luckily not so much up here in the Wasatch Back, but down in Salt Lake and in Uinta and in other areas of Utah, how bad it is for our health. Our next one is looking at one of my favorite studies. So this related to this topic. This study was published in New England Journal of Medicine in 2015. And the title tells you a lot: Association of Improved Air Quality with Lung Development in Children. We have a couple long-standing studies that have been happening in United States medicine for the past 20, 30, 40, 50, 60, 70 years. You might have heard of the nurses study that is studying nurses from when they first started as young nurses back in the 30s and 40s, all the way through their lifespan, and enrolls new people all along. There's also one called the Children's Health Study. So this particular one looked at Southern California, when Southern California implemented the use of catalytic converters and safety checks and smog checks for cars. as a result of the horrifying smog that they had back in the 70s and 80s. Everything kind of took a little bit longer to implement, but by the 90s, they were starting to see a difference in air quality. And so this looked at 1994 and basically just 15 years. And I'm just going to read this out loud. The last sentence is the key. So over the 13 years spanned by 3 cohorts, meaning 3 groups of patients, and let me get this out of my way. Hold on one second. Improvements in growth of both FEV1 and FVC were associated with declining levels of nitrogen dioxide and of particulate matter with an aerodynamic diameter of less than 2.5. What is FEV1? FEV1 is your forced expiratory volume, meaning when you try and expire all of the force of your lung. That is something that is really impaired in kids who have asthma. And your forced vital capacity is a similar measure. So when you looked at those 2 things with the less than 2.5 particulates and the less than 10 micron particulates, these associations persisted after adjusting for other confounders, namely, where did you live? What was your racial status? What was your level of poverty? Did you have asthma, et cetera? And what they found was that significant improvements in lung function development were observed in both boys and girls and in children with asthma and children without asthma. The proportion of children with clinically low FEV1 lung function at 15 years declined significantly from 7.9 to 6.3 to 3.6 across the 3 periods as air quality improved. What does that mean? The number of children with impaired lung function was cut in half in 15 years just by regulating car exhaust. Pretty profound. And hold on, that went too far. I'm sorry, let me go back. That goes to here. So you may say, yes, that's California. Let's talk about Utah. Well, let's talk about Utah. So does anyone know the significance of 8/6/2021? What was that date? Anyone? If you don't know, that was the date that we officially had the worst air quality on the planet. So that was a combination of our wildfires and the intense smog that had happened due to combination of exhaust, incineration, refineries, and weather changes down in Salt Lake. What do we see in Utah and how do we measure here in Utah? In Utah, we're very lucky to have a couple great medical groups that have created a thing called the Utah Roadmap. What is the Utah Roadmap? The Utah Roadmap is a guidance policy that it was created by the Eccles School of Business and is also run by the Gardner Policy Institute at the U. It has a collection of policy wonks and physicians. And what they do is they give data to the folks at Huntsman and they ask them to prove associations based on Utah. And so what the Utah Roadmap does is show us what they feel like they have proved. And what they feel like they have proved, and just to look at a couple things here, the folks at Huntsman feel that, looking over at lungs, that our air emissions, mostly cars and pollutants, cause airway inflammation, decreased lung function, visits for asthma, lung cancer, respiratory disease. Effects on heart can include increased incidence of heart attacks, unstable angina, systemic inflammation, that you can have dysfunctional heart with change in heart rate variability, with endothelial dysfunction, which means your blood vessels are clearly not responding well. And our number of hospitalizations for heart failure here in Utah are directly related to our air quality. If you look down at the RIP, our all-cause mortality is increased when we have higher emissions. Our cancer mortality is disproportionately increased here in Utah compared to expected, and our respiratory and heart disease risk. People love using Utah as an example of how to prove air pollution issues because we have a really low incidence of smoking. And when we have a low incidence of cigarette smoking and of vaping compared to other populations, it makes it easy to tease this stuff out. Well, then let's look at reproductive in children. Preterm birth and spontaneous pregnancy loss, otherwise known as miscarriage and stillbirth. In fact, some of the data suggests that 1/3 of all miscarriages and stillbirths can be related to air pollution. Then we have our children. So we know that there's an association with child onset arthritis, with respiratory illness, school absences, And this delayed cognitive impairment development stuff is actually really interesting too, and a little scary. So knowing that, the American Academy of Pediatrics, who doesn't advocate for politicians or, to be honest, parents, sorry guys, or anyone else, we only advocate for kids, has felt that these have been issues since 2007, and air pollution has been one of our top 4 priorities. That I can show you how just one little area of the country that changed its air quality dramatically profoundly improved the health of children. And then thirdly, you can see in Utah that our physicians and our policy people feel that there are very clear associations between our air pollution and our health. So what can you do? So first of all, hopefully this makes you feel a little bit more knowledgeable. Of course, we all try and change our home environments, but I really want you to get back to these next 2, which are expanding your focus and change your community. So how do you do that? None of us have time, right? We're all really busy. So I'm going to give you one example that I have found really helpful. I work with, well, before I started my business and got crazy busy, a group called Citizens Climate Lobby. So they are a nonpartisan group that advocates for people to work together across the political spectrum to promote care of the environment. And it's super interesting work. And I worked with them for years before I started with my new practice. And it's really interesting having discussions with people who come from a very wide variety of political backgrounds. And we're so divided right now. It's super painful to even have these discussions sometimes. But when you actually get in there and start talking about, I want to talk to you about the effect on children's health. I want to talk to you about the fact that air pollution is causing stillbirths. I want to talk with you about the fact that Intermountain Hospital prepares for more heart attacks and deaths on days when air pollution is higher. It makes it a lot easier to have conversations with people because it's not really political. But what did I learn through Citizens Climate Lobby? And if you can't go and join Citizens Climate Lobby right now, which I'm not suggesting, I wanted to give you one thing I learned, and that is this. There are things you can do when you have no time. And one of the first things is to physically contact our representatives. So we have 3 really interesting representatives here who I got to know through Citizens Climate Lobby. And as a pediatrician, I think moms don't realize can be a tool for you to exert your power. The first is Senator Blake Moore, second is John Curtis, third is Mitt Romney. What is the deal with these representatives from Utah? Why am I bringing up politics? All 3 of these representatives from Utah formed, John Curtis started it, and then the others joined the Climate Caucus, which is spelled incorrectly, sorry, of the Republican Party. This was a big deal this past year that the Republican Party at the national level made a thing called the Climate Caucus. All 3 of these folks make a point of working with nonpartisan advocacy groups like Citizen Climate Lobby and the American Academy of Pediatrics. Our lobbyist is heard by them. And they have all publicly acknowledged and promoted this Utah roadmap. They're aware of the data about health impacts of air pollution. So what can I tell you from my experience in trying to get our politicians to act? There are 2 groups of people who, if they show up for a meeting, everybody freaks out and is completely happy, and they have the stand and they can do anything they want. The first thing is anyone under the age of 25. And then the second group is moms. When moms talk, people listen. And that gives you a voice to not only work on how your household can be a healthy household, but your community and our state and our nation. And so to give you an example, seriously, people, I want you to get out your phones right now, because here is something that I learned with Citizen Climate Lobby. Okay. If you call these folks, and we're calling in the evening right now, if you call in the daytime, and I want to know that at least one person called tonight. Okay. I already called Blake Moore today. I call him once a month. And when you call them, they want to know what you care about and what you're happy about that they're doing and what you're not happy about that they're doing. And if you're not sure what they're doing, well, then tell them what you're concerned about in your community. So all 3 of these guys have come to these various nonpartisan groups and want to know how to get active on climate. And to give you an example, Blake Moore has come on hikes here in Summit County when Citizens Climate Lobby holds invite your public representative groups. He physically comes, like he shows up, not his other person, and he wants to know what people think. And he doesn't talk to the mayor who's always there and the city councilors. He wants to talk to people under 25 and the moms who show up and find out what is they are concerned about. These three guys have really gone to bat by saying that they want their political party to advocate for environmental health. They have different political solutions than the Democratic Party does, but they're not denying that there is an issue. And so I think you'll see in our national politics, there's both people who are denying there's an issue and people who are saying there's an issue. These three guys kind of want to change the discussion. And so I just want to make a pitch that all you have to do is pick up the phone. And literally, here's what I did today. I said, "Hi, Senator Moore. My name is Eileen Gallagher. I'm in your district. I live in Summit County. My zip code is 84098. I gave my address. I gave my email. And I said, I'm really happy to hear that you gave a speech about air pollution in Utah and that you're trying to fix this problem. Thank you. Click, you're done." And what happens is a little 19-year-old who is on the phones all day and then looking at the messages at night physically gives those. Mitt Romney especially gets a list of every person who has called from the entire state every week, and he wants to know what people think. And I think more moms ought to be calling. I think people who are home with little babies and home with kids and trying to have a life that is centered around children and who are trying to promote the well-being of children should be calling these folks, because we don't want everyone else to be calling them. We need to be calling them. And I want you to call. Literally, you can pick up right now, tell them about whether it's this issue or some other issue, and then you just hang up and you're done. So here's a bowl of food that I grow in my house in my hydroponic garden, because that's one of the ways that I've tried to make my house healthy. Big picture. Environmental health in children is super important to me because I feel like no matter how many kids I vaccinate, how many illnesses I treat, how many illnesses I prevent, how many parents I empower, how many families I promote, that it doesn't mean anything if the areas around them, their environment is unhealthy. And I worry because I think someone needs to be advocating for our grandchildren. Someone needs to be playing preventative health promoter for our planet. And I think that the perfect people to do that are moms and pediatricians, because we are not self-interested. We are doing it for others. And that makes our voice powerful, and it makes us heard, and it's good for our kids. So to sum it all up, the American Academy of Pediatrics has your children's back. We are working at a state and a federal level to try and reform our own mess, as well as to try and promote a healthy environment for kids in many, many ways. The 4 areas that we feel strongly about are air pollution, water quality, extremes of weather, and unnecessary exposure to chemicals that can be harmful to health. And we invite you all to get involved. One of the easiest ways you can get involved is literally pick up the phone and call after hours if you actually don't want to talk to someone, and leave a 20-second message with your representative about the fact that you are a mom and you care about these issues. So thank you all for coming.
Thank you so much, Dr. Gallagher.
You're welcome.
Do we have
Dr. Gallagher, that was fascinating. I have so many questions. And, I think that it brings to light, obviously, some simple steps that we can partake in to get involved, because sometimes you do feel a little bit helpless, but knowing that these representatives and senators are involved in the communities is very helpful. One of my questions has to do with living in Park City and, living on mine tailings, as well as, water systems that are related to it. I do know that we have one of the most advanced water system treatment facilities in the nation. We have really great
Right.
water, but a lot of also houses in have reverse osmosis systems to try to eliminate some of those harder metals or chemicals or things of that sort. Is there a problem that you see? Because I know there are, you know, little supplements you can add back into the water called like trace minerals or whatnot. Do you see a problem with like getting too clean on like the other end of the spectrum? You know what I mean?
Yeah, that's an interesting concept that people have talked about a lot more recently. And yet it's a hard one in that I dove into that, I think about 2 years ago, and I couldn't find any what we call peer-reviewed medical literature that really looks into that. But I do hear a lot from people who are either adding minerals back or trying to balance their water, that it really improves the health of their hair and their skin, that they're having children who have less eczema, so they're using less steroid. And so I'm completely fine with people experimenting with their water with those very safe, non-harmful alkaline, usually additives, but I just don't know that the data is there yet. I mean, from the thing I would promote from a pediatric point of view is all the stuff that gets taken out is supposed to be taking out heavy metals. One of the heavy metals that gets taken out is fluoride. And so I feel like we see a lot more cavities and poor dental hygiene in kids here than I have in other places because they're not getting any fluoride. So I start all my kids on fluoride the second they have a tooth.
I've got a question. I feel like this has been a topic that's weighed on my mind a lot. I've got a 2 and a 4-year-old, and I saw something online that said that environmental anxiety is like a real thing. People really stress, especially I think it was mostly when during August when the air quality was so bad and we couldn't really go outside. And I was like, oh my gosh, what kind of world are my children growing up in?
Mhm.
And all of the data that you just presented is, great. And also like slightly overwhelming. So as somebody who, I signed up for Spoil to Soil in Park City. So I do my composting now and I try and recycle everything that I can and bring stuff to the Recycle Utah. But like, what would you say is a digestible amount? Because when you look at it all at once, it's so overwhelming. What would you say, you recommend to like dumb that down a little bit and not make it so difficult?
Well, I can't emphasize enough how much just making a single phone call to someone who has power in these areas and saying, this is important to me and I'm paying attention and I want to know that you represent my concerns. It's amazing the power that has. It's actually a little disconcerting to give you a number on that. So for example, I know that John Curtis, who represents 90460, but 84060, but not 84098. He has office hours and nobody calls and nobody shows up. So you would not believe how few people reach out, except for the lobbyists and the people with money. They want to hear from regular people. So I would say that. The second thing that you can do that doesn't feel overwhelming is, I think, to recognize that we're all trying to make our home, and then if we are in the workplace, our workplace more energy efficient and to create less carbon. And like by composting your food waste, that's huge. And then if you can just do one little tiny thing at a time. My kids made fun of me, but last year it was kind of my COVID hobby, I think, was I tried to get rid of one more thing that had plastic in the house. They were like, what is this new dish soap? You just pick one new thing a month that you can try and do. And that does have impact because then you're going to talk about it with your friends and people are going to notice. And then moving on to community, I think sending an email or letting people know who hold power here in our area, like the Snyderville Planning Commission and the new mayor, and just sending them a little email. Hey, I'm watching to see what you do. And it is important to me that you can say things like, we're not all stuck in our cars all the time, right? That we have good transit solutions, and that we're protecting our open spaces and things like that. Just a little one-liner really makes a difference. But you're right. The environmental anxiety is real. And sadly, as a promoter of kids' health, the kids really felt it. I have older teenagers and kids in their 20s. And some of the things that they have said this past summer were pretty startling to me. So one kid said, it was a friend of one of my sons said, yeah, we're going to look back on 2021 and remember when that air was so great. And it was only in the 90s for like a month in the summer in Park City. And I honestly started crying, like my eyes twitching right now thinking about this, but that's what we don't want. And so we do have to start small, but we do have to utilize our resources. And I don't think people realize how many resources they have in folks who might not belong to the political party you do, or you may never have spoken to, but who want to know what your average person is thinking.
Thank you. And also actually to your point, and then I know, Anna, you want to ask a question. There's an awesome mompreneur who just started a store in the Kimball outlets, and it's called Fulfill. And you can bring all of your like reusable laundry detergent, hand soap, all these different things, and she'll fill them. And so it's like trying to promote
Oh my goodness, that's wonderful.
Bottle. And
Yeah, she's awesome. And she did like, you could bring your Halloween candy there to be recycled. You know, there's just so much good stuff there.
And what is the name of her company?
It's called Fulfilled Utah. And it's like one of these places where you can get your like soaps and stuff filled up. So you just bring your own container and you fill it up. But she also sells like unpaper towels and things like that, you know, you can use. Hi, Dr. Gallagher. Good to see you.
Nice to see you.
My kids see Dr. Gallagher. I love that talk. I'm really involved in the climate space. And I'm about to launch a new media thing that's aimed at people like us who just don't have time because there's nothing accessible. It's just so doom and gloom and everybody feels like there's nothing that they can do. When, you know, there is a lot that we can do and just taking these actions and then trying to talk about it with people, you know, or going to your school or talking to the Park City School District or becoming an advocate or even just telling somebody that you compost can go such a long way. So Project Drawdown also has a lot of great resources. Like if you're just looking for like, what's the biggest impact, like food waste is an enormous impact. And that's such an important area to like educate our kids about and all of that. But I was going to ask you about your hydroponic garden.
I'm obsessed with it. In
what
fact,
do you
one of my
use?
friends was like, it's your boyfriend. But so I just got tired of buying cruddy produce, and we definitely don't have as much year-round produce as I would like. And I'm spoiled because I used to live in California where you just drop something in the ground and it grows. But so I have a hydroponic garden that has 30 different plants. And so I'm usually growing about 10 or 15 heads of lettuce and spices and herbs. And sometimes I'll grow things like snap peas or tomatoes just for fun. I don't get a huge yield from them, but they're so fun to just see them climbing up the wall of the house. And it's so worth it. I haven't bought lettuce in 2 years.
Which one do you use? Which brand do you like?
The Garden, Gardyn. It was super expensive. My husband gave it to me as a present, but honestly, I have not bought lettuce in 2 years. And so I think that it has paid for itself by now with feeding 6 people. And when people show up, all the lettuce for, you know, close to 700, 800 days.
Awesome. Thank you guys for putting this together.
I love it.
Thanks for joining.
I have a question for either Dr. G or maybe even Anna. Being so strapped for time, I'm very, very sensitive to add, on because you have been so gracious with your time tonight. But is there anything that we can, for someone who doesn't watch the hour video, I would love just a bulleted I don't know, Anna, if you have anything that's accessible, or Dr. G, you do with your message. You're so passionate. I totally am going to call. I love that message. I love the way you deliver it. And I'm also really encouraged by what the U is doing. I work with the U and I find them really progressive, and it really does, to see political parties doing anything together. I didn't even know that happened anymore. So, I mean, on so many different levels, And maybe we just have to encourage our parents to watch this, but I am requesting if we can send with the recording, a really short, informal,
Yeah.
not fancy.
And I'll put it on my
handout.
social media too. So I'll put a little
I
blurb
really love it.
on my Facebook and Instagram. But honestly, I would feel successful tonight if I knew that everyone made one phone call. Just make one. Okay.
You
Everyone
love
pick
it.
a representative. One.
Put your thumbs up.
Okay. Just
I'm
make one.
totally doing.
Because
gotta jump,
honestly,
but
they're
thank
going to be
you
like,
guys.
what's going on in Park City and in Summit
Thank
County?
you.
All the moms are on it. And you might even get invited to the town hall. You might be invited
Oh my
to
God.
other things. And then you're off to the
I love
races.
I love it. Now you said that John Curtis though was not, I took a picture of it, so maybe I'm even saying his name wrong, but you said that he's not, I'm 84098. So would it be best to
I will call one of the others.
Senator? Yeah. Okay, cool. And then these are the representatives and the senators that are part of the climate. So you find them that they are listening rather than a senator that we have that is not on this list. It's
Right.
it's not worth their breath. Okay.
Yeah.
I appreciate that.
Dr. G, I do have one last question if we can fit it in. I do have a question about with schools, right? In terms of the cleaning with COVID. I was talking to a mom the other day who went into the school to help with a craft or something. And she told me that they had the kids all leave the room and they go in, they spray the room. And then they leave. And I don't know if they do it like one or two times or several times a day, but she said it smelled like really like strong chemicals. I don't know if you know anything about that, first of all. And second of all, is there anything that we can do to supplement our children with like, I don't know, any detoxification with their diets or anything of that sort to help like balance that? Because I haven't been present to it.
Well, they're supposed to be using alcohol-based sprays because they're super effective and they evaporate quickly after killing what they touch. And so that's what they're supposed to be using. If you wanted to think of ways to get kids involved or to find out more about what's going on in the school, there's a very active group at Park City High School called the PC CAPS program. And they're trying, interestingly, as we've seen with COVID in the schools, they're trying to get the school district to comply with the county's plan for becoming carbon neutral. The school district has claimed exemption from the county's plans for that. And so there's a group of high schoolers who are really passionate about that and trying to work on the schools and make them as healthy as possible for kids. So you can look into that group and then give them a thumbs up. And then, I mean, in terms of supplements for kids, it's really about prevention. We have to prevent. And then, of course, having a high antioxidant diet and I'm okay with antioxidant supplements if they're reasonable, not mega for kids. The first one being vitamin D, which is one of the most important antioxidants, but it's about preventing, sadly. So.
Well, thank you so much. We really, really appreciate you. And I hear from many of my new mamas, a few that are here with us who are your clients or know of you, and just thank you for all you're doing. So
I see some of mine.
we
There we go.
appreciate
Yeah.
that.
Hey, Mom.
And thank you so much. I'm going to stop recording and thank you for watching.
Yeah, thank you for having me.